What if I was to tell you that I'm almost certain your sciatica is not from Piriformis Syndrome? We're going to share with you the major flaw in the logic about Piriformis Syndrome and the stretches people use to treat it. We're going to show you a quick and simple test that you can do right now to find out if Piriformis Syndrome is really causing your sciatica. Make sure you stick around to the end for vital information on how to interpret your results. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, the information we provide is for education and demonstration purposes only. With that out of the way, let's get into it. Sciatica and Piriformis Syndrome are frequently mentioned in the same circles, but they really shouldn't be, as the statistical likelihood of having Piriformis Syndrome is low. The premise behind Piriformis Syndrome and its relationship to sciatica is that the muscle is tight in spasm or inflamed, causing pressure on the sciatic nerve as it passes underneath the piriformis. However, it just doesn't happen as frequently as people believe. In rare cases, people have true Piriformis Syndrome, where part or all of the sciatic nerve runs through the piriformis muscle. This happens in around 2% of people. This is a congenital anomaly, meaning it's present at birth. Along with the test we're going to show you in a couple of minutes, and knowing a little history of symptoms, we can reasonably rule out Piriformis Syndrome. If your sciatica just appeared one day and has not been present most of your life, it is reasonable to assume that you are not part of the 2% with a congenital Piriformis Syndrome. If present from birth, one would expect symptoms to be present every time the piriformis contracted, as it would squeeze part of the sciatic nerve actually running through and not under the piriformis. So now we're left with the remaining 98% of people that could get what we call acquired Piriformis Syndrome, where for some reason the piriformis muscle gets tight or inflamed, causing it to compress on the sciatic nerve. You will see other YouTube videos recommending doing piriformis stretches to relieve sciatica, to try and loosen or stretch the piriformis. On the surface, this seems to make sense, especially as most people get near immediate relief from doing them. Examples that you will often see are the figure 4 stretch in laying or sitting, double knees to chest, the prayer stretch, lower trunk rotations, or the spinal twist. But the entire premise of recommending these exercises is flawed, and you're going to learn why. What happens when you stretch a muscle? Let's use this paper towel as the sciatic nerve, and we're going to use this band as the piriformis laying over the top of it. Watch what happens when we stretch the piriformis. Did you see that? Stretching the piriformis compresses the sciatic nerve more. Do you see the flaw in doing piriformis stretches? Remember, the claim of Piriformis Syndrome is that the muscle is tight and compressing on the sciatic nerve. But compressing the nerve harder makes your symptoms better? That's like saying if you burn your hand with boiling water, pouring more boiling water onto it will make it better. It's completely illogical. If a tight piriformis muscle was causing your sciatica, piriformis stretches should make you immediately worse and not give you immediate or near immediate relief. Okay, so now I think you're ready to test for yourself. You're going to lay on your back and place the ankle of your sore leg on the thigh near the knee of the other leg. Reach up between your legs and grab behind your knee, and pull your knee towards your chest. If you can't reach, you can use a towel to help. Just hold it for a few seconds. You can do it a few times in a row if you do not get a clear indication of what's happening with your symptoms. Now the next 30 seconds are really important. If you got relief, i.e. your symptoms decreased or got better, you do not have sciatica from Piriformis Syndrome. If you had Piriformis Syndrome, these types of stretches compress the sciatic nerve more and should increase your pain, not relieve it. If your symptoms got worse, it does not mean that you definitively have Piriformis Syndrome. There are far more likely explanations. This test is a good indicator for ruling out Piriformis Syndrome, but not good for ruling it in. So how you did on that test will help determine which exercises are more likely to help. And we're going to talk about those exercises in our next video, so make sure that you don't miss it. Before you go, please give us a like and share us with your friends. Make sure you don't miss any of our upcoming videos by hitting that subscribe button, and we'll catch you on the next one.